Hey guys, back from the dead. Um, let's see, this is Friday afternoon. Still haven't had the babies yet, but by the time you watch this, don't know if that will have changed or not, so who knows. Right now, just kind of resting at home. Miss y'all dearly. Um, did need to talk about this real quick so that we actually have some material for y'all to test over on Thursday. So, I'm going to go through this pretty quickly. Most of it's self-explanatory. Um, if you miss blanks, this is posted to my YouTube channel, which is just my name. It's not anything crazy. But it's also, you can find it in your book. It's literally word for word what the book says. It's just, I put it in a PowerPoint so I can discuss it. And y'all can all look at it. So if you have any other questions or you miss blanks or something, it's in the book. We're in chapter 6. We were talking about blood lymphatic system and the immune system. We're only going to get to the blood part of it. We'll do lymphatic and immune system when we get back from break. So we talked about the anatomy and physiology of blood, and then y'all have since then done index cards reviewing parts of words that have to deal with blood. So now we're going to look at different diseases and procedures and stuff regarding blood. So no fancy pictures on this PowerPoint. I got lazy, but I got stuff going on, so whatevs. All right, so looking at pathology, so looking at diseases. So the specialty that's going to deal with blood stuff is hematology. So they're going to look at the treatment of diseases of people that have blood problems, and then your actual doctor is called a hematologist. Again, I'm going to kind of speed through this, so I may not go through every single one of these guys and describe them, but that's usually because the definition pretty well explains it and there's nothing more to add to it. So signs and symptoms of blood disorders, you can have things, a blood clot, and that's where all the blood comes together and it clots. See, not difficult. So bunches of stuff coming together to combine to make a blood clot. Coagulate is like the process of the blood clotting. So it's going from something that's liquid and can flow to a gel solid. If you ever get a chance to go look up a blood clot, they're kind of weird looking, kind of looks like jello, a little more solid, massive, kind of oogly, kind of gross. So the actual process of blood clotting is coagulation or coagulate. Dyscrasia, never heard this word in my life, but it's just talking about, it's like an ancient term referring to the presence of disease affecting the blood. Anyway, ain't going to be on your test. Don't worry about it. Okay. Hematoma, fancy term for bruise. So you damage the blood vessels underneath the skin. Blood leaks out. You can see the purpley collection of blood, but you're not actively bleeding out of your skin. If you start bleeding out of your skin, then that's called a hemorrhage. So that would be the flow of blood. So you cut your wrist, you have a flow of blood, that would be hemorrhaging. Or if you stab yourself or some other violent thing. Continuing on, hemophilia. So we talked about this, about Sam and her mom, about how they both have different conditions that they had the factor V deficiency, which gives both of them hemophilia. So again, this is going to affect their clotting time and makes it more likely for them to bleed after a cut versus being able to clot properly. And so look at this. This is a sex-linked trait So most of the time it's going to present itself in males, hemophilia in general. But some of when you get into the factor whoever's that are affecting the clotting cascade, sometimes that doesn't matter if it's male or female. But usually people who are hemophilic are going to be males. But again, obviously that's not always the case. Hyperlipidemia, that's just talking about the lipid levels are very high in the blood. So when we talked about atherosclerosis in the cardiovascular chapter, this is what's going to contribute to that. So you have high levels of fat in the blood that's going to stick to the walls and then narrow all your blood vessels and lead to coronary artery disease, which leads to a heart attack. So pancytopenia, so pan meaning all, cyto cell, and penia meaning too few or very little. So this would be having too few of all your cells. So white blood cells, red blood cells, platelets, everything. And this is usually going to be an issue from your bone marrow not producing what it needs to. Septicemia is when you have any sort of microorganism in the bloodstream. This says bacteria. Technically, that's bacteremia. Septicemia is more of a general term, just meaning there's something in there that shouldn't be. But whatevs. Sepsis is just talking about that you have an infection everywhere. And sometimes that's referred to as blood poisoning. So specifically looking at red blood cells and different things you can have wrong. You can have anemia, which is where you don't have enough red blood cells. And like it says here, there's a large group of conditions. There's tons of different types of anemia, and we'll kind of look at a couple. And I'll narrow down which ones I want you to for sure know for the exam. But again, you don't have enough red blood cells, and that's anemia. This can be caused by a number of different reasons, and we'll look at those. And so if you don't have enough red blood cells, those are responsible for carrying oxygen. So that would affect how much oxygen you have in the tissues. Aplastic anemia is looking at the fact that the bone marrow is not producing enough. So this is a problem regarding that. It's not anything else in the body. It's the bone marrow not doing its job. And that's why you don't have enough red blood cells. Erythrocytosis is having too many red blood cells, which you would think more red blood cells, more oxygen, awesome. But if you have too many red blood cells, you actually thicken your blood, causes problems. Again, this is all about balancing. You don't want too much or too little of anything. Otherwise, you are going to upset balances. So, opposite of erythrocytosis is erythropenia. So, too few of the red blood cells. Looking at another kind of anemia or hemolytic. So hemolytic means when your red blood cells just like destroyed or are like busted open. So anything that would cause that to happen. When we talked about blood transfusions, if somebody was to get the wrong type of blood, hemolysis, which is talking about this here, where the red blood cells bust open like that, is going to be a result of getting the wrong type of blood. So that would contribute to hemolytic anemia. So hemolytic reaction, like I just said, happens in